Good morning. Today, our topic is going to be gut health. And the common denominator being is our gut health at the root of most of our issues. So, Hippocrates said many, many years ago, all diseases begin in the gut. The objectives for our talk today are basically defining what is the gut. What are the functions of the gut? Digestion is pretty obvious. Immune surveillance, the gut-brain connection, the microbiome. What can go wrong? How can we fix this? And then a brief summary. So what is the gut? Our gut basically starts at our mouth, ends at the anus. It's a combination of hollow organs. So our hollow organs, being our mouth, our esophagus, our small intestine, stomach, small intestine, large intestine. And then we have the solid organs, which are our liver, our gallbladder, our pancreas. And so these all together are working together as our gut. The interesting thing that I think most of us don't think about is the fact that our gut really is external to our body. So it's contiguous with our skin, but if you think about it, we're like the whole of a donut. So it really actually is external to our body. There are about 100 trillion bacteria in our gut, and they play a huge role in our health. And so as we go through, we'll talk about this anatomically, and that's how I'll kind of review like what can go wrong at different places as well. So what does our gut do? The obvious things I think people understand, it digests and processes food and nutrients and eliminates waste. Not so obvious maybe is the immune function, the neurotransmitter function, the metabolic function. And really looking at this, this slide came from one of my functional medicine slide decks. We have basically our intestine, and it's got lots of bugs in it, and we have this barrier, and so different things, nutrient and fluid uptake, the liver helps process some of those things, our immune tolerance. So this is where we start to think about like food allergies or intolerances, prevention of allergies, defense against infections, and then our signaling to our brain and our brain to our gut. Like what role is that playing in our mood? What about our energy levels? So lots of things to do in our gut, and I think not everybody fully appreciates, like just how central of a role our gut plays in our health. So talking about digestion, if we think about like what's happening in our oral cavity, we chew food, there's saliva production, that starts the breakdown of food and nutrients. So sometimes one thing we need to do is literally like stop and chew your food. So that can help a lot of people with heartburn, because then it sets up, more like acid production and just more of that digestion. Our stomach is really an acidic environment. It really actually sterilizes the stuff that end up in there, which that helps us not get an infection further, down into our digestive tract. There's also more food breaking down in there and churning. The small intestine is about 20 feet in length, and this is really the main area where nutrients get absorbed. So when we have folks who have Crohn's disease, people who have had a gastric bypass, things like that, where we're missing some of that or it's not functioning well, you can see how that could lead to nutrient deficiencies and other problems from there. Colon, super important for short chain fatty acid production. We talked about that previously. And really it processes the remains for excretion and absorbs water. And it's all this peristalsis that moves things through. When we really think about the liver and gallbladder, the liver creates bile, which can be stored in the gallbladder. It helps with the digestion of fats. The liver also creates protein and glucose from nutrients it gets from the small intestine to create energy. The pancreas is really involved in digestive enzymes, and it's also really important for insulin and glucagon production, which for anybody that is aware of diabetes or knows somebody with diabetes, that's where we're seeing some of this dysfunction at times. And certainly in the case of type 1 diabetes, you're looking at a pancreas that's not functioning to produce insulin. Type 2 diabetes is a bit different, but it certainly can progress to the point where you're having trouble producing insulin. And these things clearly all work together, and they're not only linked together, but they work together to, provide us with the nutrients, our way to take things in and utilize them. When we talk about the immunity in our gut, 70%, nearly thereabouts, of our immune system resides in our gut. Given that our GI tract is connected to the outside world, there's a lot of sampling that gets done, and it's kind of like threat, not a threat, threat, not a threat. So we have something called our GALT, which is gastric associated lymphoid tissue, and then the MALT is mucosa, so the lining associated lymphoid tissue. Some of these MALT tissues are tonsils. We have specific structures in our small intestine called Peyer's patches. We have lymphoid aggregates in our large intestine. And, what really you can see a little bit, what I want people to see here is, we have like the lumen, or basically the center, the hollow area in our gut. There's a mucus layer. This is where our microbiome plays a role. And then we have our cells here. In different things you can see, like just regular epithelial cells, goblet cells secrete things. But how do things get through our gut? And you can see how this barrier is so important in maintaining our health and the health and integrity of our gut. Looking at, when we think about different things with the mucosal immune system, like really it's our line of defense. And that's where if people, think about like if you get sick, like you don't tolerate food as much, things make you feel sick. Like that's all part of that gut barrier. So, we have our intranasal tracts, we have our oral tract and all of our salivary glands. All of these things play roles in this immune system. So our gut is super important for our immune system. Moving on to the gut-brain connection, there is something to really think about here called the enteric nervous system, and sometimes that's called the second brain. It's part of our autonomic system, the part that we don't, our heart beats, we breathe, those kind of things without necessarily having to think about control. Certainly we can impact that, but it really, if we were unconscious, that would still happen. The enteric nervous system is influenced by our gut bacteria. It impacts motility, absorption, secretion, blood flow in our gut. It helps maintain our gut integrity. And we've talked previously about the vagus nerve, but that is really a highway between our gut and brain, and our brain and gut. Another important thing that happens in our gut is serotonin production. And so that plays a big role in mood and motility, and that as well is influenced by gut microbes. And certainly for anyone who has ever been placed on a serotonin reuptake inhibitor for depression or anxiety, often one of those side effects people will have in the first week or so of taking this medication is they'll often have diarrhea. So that just goes to show what that serotonin does in our gut as well as brain. So a little bit on the microbiome, it's interesting. So the microbiome is really collectively talking about like all of these bacteria, yeast, fungi, all of this stuff that's within the lumen of our gut. And, there's plenty of places that they say there's more of them than there are of us in our body, which is quite possible. But really, when we start to look at like the microbiome and all these bugs in our gut, you can really start to see like how, you know, this slide is complex, and I don't expect anybody to like completely study it or understand it. But when we look at different species of bacteria in our gut, the Bacteroides, you know, that really plays a role in our immune system. So does Lactobacillus. Most people have heard of that with relation to like yogurt. E. coli. E. coli is important for us, but E. coli can cause, and we know, bladder infections, probably the most common cause. Other different bacteria here, we can see like they have to do with drug metabolism. They do with nutrition, different things with our behavior. You know, basically looking at angiogenesis is creating blood vessels. So there's so many things that this microbiome interacts with in our system, and really part of our healing process, if we become dysbiotic, if you will, we have an imbalance, is really trying to get this back in track. So what can go wrong? Well, when you think about things from an anatomical, you know, standpoint, we can look at like in our mouth, you know, what can happen with salivary glands, and there's different disorders that can happen in terms of not enough saliva, or are we changing the bacteria in our gut? A lot of things around poor chewing. So really one of the number one things I think we should all be asking is really like, are we chewing our food? You know, what time are we eating? Those different things will make a difference. Our esophagus has smooth muscle in it that helps move food down into our stomach. You know, there's a little sphincter at the bottom of that esophagus, and that theoretically is going to keep food, liquid, those kind of things in our stomach. But sometimes there can be disease involving that sphincter, and so we can have problems there, and that can be like a hiatal hernia. We can also have trouble with our esophagus in terms of if there's acid coming up from the stomach into our esophagus, it can really change that lining of the esophagus. And in real chronic cases, that can actually even make a conversion actually to more of cancerous type cells. So when we're really thinking about this digestion, absorption, you know, like, do people have constipation? Do we have something happening where we don't have the normal little cilia working and pushing things through? Do we have imbalance in terms of our microbes in our gut? Do we have different signaling? People can get a head injury and end up with gut issues. Just as well as with gut issues, it can lead to things like depression and anxiety. And so that goes both ways. There are definitely issues with lack of pancreatic enzymes, lack of acid in your stomach to digest properly. That will cause your bowels to slow down. So many things to think about, like, are you lacking bile enzymes or having some dysfunction with your gallbladder, and so you're having a really hard time breaking down fats? There are certain drugs, certainly proton pump inhibitors, which are acid blockers, that is going to change the acidity in our stomach. And we need that to be acidic because it sterilizes things, and it also helps break things down. So if we're on long-term acid blockers, we may not be breaking things down the right way, which then exposes us to potential more allergens and those kind of things. When we really start looking at different, you know, systemic effects, you're really, if we have poor digestion or absorption, you know, what else is happening? You know, now our metabolism is not working right. Are we having trouble with even our DNA support, ongoing growth and processing? When we have more undigested particles or unneutralized things, we get more allergies, we get more inflammation. We have more things to detox. For people who've had any trouble with bowel overgrowth, you get more fermentation, so you get more gas and belching. And so it's really a balance of having all of these things in place so that everything functions properly. So when you look at like a healthy gut lining, there's these little healthy villi and healthy cell junctions. So clearly it doesn't look just like that, but this would be, schematic representation. When we look at something like leaky gut, what's happening? Here we have our gut. Here we have some of our cells. These are normal, healthy little tight junctions. This is the way it should look. But so there's a couple of ways that things get through our gut wall. And this is part of a normal process as well as can be part of an abnormal process. So things can pass through paracellular, so between the cells, and that's normal. Things can also pass through with different signaling molecules here and receptors, transcellular, so it can come through the cell. So when things get broken down, we need nutrients to come through, and that's totally normal. If we take like these little guys, say they're little bad bacteria, if these guys get through, now we have things in our blood, and now we're going to be more concerned about like, whoa, now are we going to create antibodies to things? And that's kind of where that immune system is always like, is this a good guy or a bad guy, a good guy or a bad guy? So whenever we eat something, our immune system goes to work thinking about this. And the other thing that can break down is food allergens, and food allergens can cause all kinds of problems, not only with foods alone, but can that trigger other problems as well as inflammation. So this is a nice slide for kind of what can happen with leaky gut. Basically, we can take some normal processes and they can go wrong, or we really just lose those tight junctions and kind of everything goes a bit awry, if you will. So when we have dysbiosis or that imbalance in our gut microbiome, that can alter that integrity of our gut lining. So we think about just different foods, stress, infections, inflammation in your gut, lots of diseases. If you have low stomach acid, if you have chronic constipation, we're intaking toxins. Like no matter how we eat right now, we're getting toxin exposure. Nutritional insufficiencies. So are we not eating a good diversity of fruits, vegetables, colors, healthy proteins? And then what medicines are impacting this? Clearly, one medication that would impact this significantly is going to be an antibiotic. So if we do end up with this altered microbial balance, then we get more gut permeability problems. And so now we're increasing our risk for malabsorption and malnutrition. We're increasing our risk for food, sensitivities or allergies. And we're also getting more toxins in our system. This can play a role in our cholesterol. And so basically our immune system gets activated. And we've talked before a little bit about food sensitivities in previous talks, but this kind of again ties things together, if you will. So to talk lastly kind of about, like, what do we do? Like, and obviously every person, we've got to, make modifications based on what is happening. But really, I think when you think about the anatomy and some basic physiology, you can start to kind of think about like, okay, am I chewing my food well enough? All right, that's something we can do. That's easy, it's free. But there is a framework that I've learned through the Institute for Functional Medicine, and this is out on, Dr. Google and everywhere else. But basically the 5 R's. We think, number one, about removing. What needs to be removed? So are there irritating foods? Is there an infection maybe we need to treat? Are there toxins? Is it just stress? Stress in our life is going to cause problems in our gut. So we can use things like an elimination diet. We can treat with antimicrobials. So whether it's an antibiotic or an antifungal, certainly balancing stress, that can make a big difference. And if there's toxin exposure, what do we need to do to make sure that your body and your liver can really detoxify these things? And even just hydration, so that you can actually move these things through your system and you're not constipated and storing these toxins in your colon because things aren't moving through. The next thing we think about is replacing. So what do we need to replace? Do we need Do you need acid actually in your stomach because you've chronically been on an acid blocker? Do you need more fiber in your diet? Do we need digestive enzymes? So those are all different things about like what do we need that can help us in terms of making our digestive system function properly. When we think about re-inoculating, like what do we need to restore this healthy microbiome, and sometimes we can think of prebiotics. We've talked about fiber before, so soluble fiber, inulin, there's fructooligosaccharides. There's different things we can do for prebiotics, and that's basically, this is food that's feeding the gut bacteria. Probiotics, do we need to add back in some of that lactobacillus or the bifidobacter or even S. boulardii, things that we know will help, maintain that gut lining, will help support its health and integrity. So sometimes we need to add those things. And then when we talk about symbiotics, that actually would be taking a combination of a probiotic like bifidobacteria and fructooligosaccharides, and that can actually work in combination to help. Lactobacillus and inulin can also help. In some of these things, inulin, chicory, we find these in fiber supplements, it's in some foods. So, really a lot of what we're doing is like re-inoculating, like fermented foods, making sure you're getting all different colors in your diet, limiting sugar, like all of those things will play a role. The next thing we're thinking about is repairing. And how do we repair that gut lining? What nutrients do you need, for healing your gut? We know that things like glutamine, arginine, vitamin A and D, vitamin C, zinc, pantothenic acid, vitamin E, all of these things can help support our gut. A lot of these things we can get through a healthy diet. Other things like phosphatidylcholine, though that can actually help support your mucosal lining. It basically helps with the secretion of stuff that creates that barrier to protect your gut as well. Whey immunoglobulins, lactoferrin, immunoglobulins can actually help support that GALT, that gastric associated lymphoid tissue that we talked about a little bit. Antioxidants are helpful for our gut, as well as things which we talk about commonly with other things, curcumin, omega-3s, EPA and DHA. Those are all super important things for our gut lining. And then lastly, balance. When I first learned this, it was the 4 R's, and then they've added balance, which really makes sense because what got us to the point that we were sick? What do we need to do with our lifestyle to avoid disease? You can eat well, sleep well, exercise well, but if you have a bunch of stress in your life, you could still have gut issues despite doing all those other things right. So a lot of like stress management, do we just need to slow down and eat more mindfully, chew our food? How important is movement? All of those things will make a difference in terms of, how do we approach this? So clearly everybody's an individual, but there are things that we can do, collectively. And part of it is just, like think about what you're putting in. Is there something I should be eliminating? And that plays a really big role. So in summary, really what I want people to take away most is like, this is all about balance. It really is. Nutrition matters. Our quantity of food, our quality of food, when we eat matters. In our lifestyle more so than anything. And we know that when we talk about every sort of dis-ease, we talk about movement, sleep, stress, all of these things are so important and really important in our gut. And, lastly, the system is really complex, but it's also pretty simple. And if we really look at that whole picture, I think we can figure out, like, wow, what's going on? Why maybe did that happen? And then when we can figure out why maybe that happened, well, wait, what is there that I can change with regards to this? So, really we can address a lot of these problems. And, most of just because we end up with a problem in our life, pharma would like us to think it's because we're lacking the newest, latest, greatest drug. But really, none of us are born with a lack of something like that outside of some genetic things. But it's not necessarily calling a drug. It's for us to really break this down and slow down and think about where in the process could this be a problem, and how do we address that? So with that, not so many references today. A lot of it is my functional medicine training, but there are definitely there's lots of great references out there for you. And I just want to thank everybody for listening, and hope everybody has an awesome day.